So there's new reimbursement codes, especially in Medicaid, for things like housing navigation, assessment, providing advocacy and support. Now they can get paid and valued and get sustainable revenue versus relying on grants that are short-term and often run out.
This is Startup Health TV. We celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. I'm here with Colby Takeda, CEO and co-founder at Pear Suite. Colby, always good to see you.
Always good to see you, Logan.
Okay, so you guys are innovating in the area of community health workers. You're activating this part of the healthcare ecosystem that maybe hasn't been fully appreciated and activated before. Kind of lay the platform out for us.
Yeah, absolutely. We recognize the value of these skilled, experienced, on the ground, local individuals who are helping with things like housing, transportation, community resources, caregiving, education, such valuable elements of health and well-being. We know they can make a difference. They were on paper and spreadsheets, however, so we wanted to give them a platform to collect the data they need to do assessments, to provide actionable resources and solutions, and actually get paid for their work. Because they are valuable, they should be compensated.
Okay, so who is a community health worker? We're talking about people at a community center, a church, a YMCA. Who is this?
Yeah, absolutely. All those above. We're seeing people that take their lived experience, formerly houseless, formerly incarcerated, people that have gone through the trenches and had food stamps to survive. These are the best people that can help their neighbors, their friends, other Medicaid members. We're seeing that they are so powerful. We just need some technology and support to make them even more powerful.
Okay, so you just said that they typically work on like paper and spreadsheets. So if I'm working for one of these community organizations, I'm doing it out of the love of my heart. Oftentimes I'm volunteering. I'm just doing my best with my paperwork. And Pear Suite comes along. What's the difference?
Yeah, so there's new reimbursement codes for them, especially in Medicaid. About 30 states offer reimbursement for things like housing navigation, assessment, providing advocacy and support. Now they can get paid and valued and get sustainable revenue versus relying on grants that are short-term and often run out.
I'm going to go out on a limb and say most of these folks don't know about these new reimbursement codes.
Yeah, so awareness is huge. Pear Suite has become more than just another technology company. We provide them education and training, provide them resources around billing and coding. We help them understand the policy for eligibility, who can bill for these services and why. And we help them with the billing and support so they don't get their claims rejected. We help them get more money in the bank so they can do more work and create more impact.
Okay, so the people part of this is huge. These folks already have the passion and they're ready to go. Where does the tech play in? Why does the platform matter?
Yeah, you think about, you have probably a CRM of all the members you're working with. You have a list of resources. You have a phone system. All these different things are separate. Billing is a separate system. Clearinghouse is a separate system. We put that all into our platform, give them everything they need to work on one system, document, code, track time, get paid. It's pretty amazing.
Okay. I know when I first interviewed you a few years ago, it was basically like 3 or 4 people, baby company, and you've really been growing. So kind of like, where are you at today? What are some of the milestones you're excited about?
Yeah, I started off a small company out in Hawaii. Think about what kind of digital health company builds in Hawaii, but we've gone from 1 customer to 100 in less than 2 years.
Wow.
We're really excited about the growth that we're seeing naturally, but also the partnership with the health plans. You think about small organizations, maybe easier to sell, smaller budgets, but health plans are really where the business is. They really want to work with these groups. They want to build capacity to support members on the social mental health needs. They need help getting connected to these community groups, onboarding them, contracting them with them, helping them with the clinical review. We provide all of that in our system, and now we're across 25 states working with 18 health plans.
Okay, I want to break down some of the secrets of your success because 100 clients in 2 years. You know, I work with a lot of startups with Startup Health. Some people struggle. They're not seeing that kind of hockey stick of acceptance. Part of it is the cultural shift, appreciation of these community health workers, I'm guessing, but there's got to be other pieces coming together. Why this rapid growth?
Yeah, I think it's a combination of more investment in this space. We're seeing different administrations and state governments investing in training and workforce development for their community health workers. We're seeing the policy shift, of course, with reimbursement. We're also seeing a lot more data on the value and the ROI of community health workers, which is really powerful. So I think the timing is right, but we also really understand the community organizations. We understand the community groups. Many of our community members or our team members in our organization are from the community doing work with nonprofits. We have about half of our staff are actually community health workers themselves at one point in time. They've gone through training, they learned what it takes to be a community health worker, and I think that understanding of the knowledge of the community is really helping us succeed.
Given the kind of people that you're helping on a day-to-day basis, I'm guessing you get some great testimonials that help keep you going when times are tough. Do you recall any stories that really kind of help you?
Yeah, one individual, and actually it's interesting, I myself, as a CEO, still go out there and do home visits, to interact with clients, to meet them in the community. Yeah, I learned so much about the experience of what a community health worker does. I also gain a lot around what the needs of our clients are, and that really informs our product roadmap, the way we train, the way we coach, the way we operate as a company. I really appreciate it, and our health plan partners actually appreciate that quite a bit as well. But one individual I visited, she had a housing insecurity need. She wasn't eating very well. She also had cancer and was actually skipping her cancer appointments because she had all these other challenges. I got to know her first. I didn't come to her and say, hey, you have to go to your doctor. You have to see your providers. I said, how do we help you with your food? How do we help you with your day-to-day needs? She trusted me. She got that relationship built, and that led to bigger opportunities to address her cancer. And she said, I'm going to commit to going to my appointments and seeing my provider.
Now, Connect for me, that's just like human-to-human interaction,
Yeah.
you being a good home health aid. Connect that to the tech side.
Yeah.
Why are you also better off with Pear Suite behind you as that good health worker?
Yeah, these community health workers are amazing. They have that lived experience, but a lot of times they don't remember all the different opportunities or services or programs that might be appropriate for someone. Our software will take assessments like social needs screenings, like a PHQ-9 around mental health, and it'll prompt the community health worker to ask around resources and services. Are you interested in SNAP benefits? Are you interested in this housing program? Do you know how to use Lyft and Uber so you can get to your doctor in time? All these programs are provided to them. It's prompting the community health worker to ask around enrollment and engagement, and closing the loop on, let's get you solving these social needs so you can actually get better care.
Nice. So you're 100 clients, 25 countries, states. What's next? What are you looking forward to? You just need to maintain that, or are you going to double again?
Yeah, excited to see our growth continue. Obviously, we want to get more data on the value of community health workers. A lot of these community health workers are doing amazing work and impact, but they haven't been asked before about ROI or on impact or on clinical outcomes. So we want to help them get that story so they can then go on and build more contracts. Since we last spoke, we've actually built a provider network, and so everyone using our software is ready and able to work. Sometimes they just need help getting connected to more clients. And so our health plans have said, if we can activate this network, if we can help them with resources, could we give you lists of members? Could we help you engage specific populations that we are struggling to engage with? We're actually that connector. We're that matchmaker between the health plans, the community members, and the organizations that are doing the work. That's allowing us to really expand our work. Health plans really love when we can expand and grow their capacity to provide care really easily, and all our providers love it because they can do more work, help more people, and get connected to the health plans that previously they couldn't.
I love it. Colby, thanks for the update. I wish you the best in the next year. Keep it up.
Thanks so much, Logan.